Hello dear friends, I am Dr. Jothydev Kesavadev from Thiruvananthapuram in Kerala. Here I spoke about the use of interchangeable glargine in type 2 and in type 1 diabetes. And this is a made in India innovation. If you look at the scenario of type 2 diabetes in our country, in more than 80 to 95% of the population getting treated for diabetes, the glucose is unfortunately not under control, resulting in devastating and disgusting complications of diabetes. And how can we prevent this? This can be efficiently and effectively prevented with early use of insulin. And use of insulin early enough is probably limited because of multiple reasons. And now in India, we have the interchangeable glargine, meaning even a pharmacist in the United States can substitute the original for this particular molecule which is innovated in India, and that is a made in India glargine. And this is the only interchangeable glargine not only for India but available all over the world, and with a very simple algorithm. So we need to start basal insulin sufficiently early, I will say, if possible before the onset of complications in diabetes, and you monitor the glucose values in the fasting state for multiple days, and for every 3 to 4 days you increase the dose of insulin by 2 to 3 units. So this is pretty very early. And how to start insulin, how to start the basal insulin such as glargine? You start at 0.1 units per kilogram. So this is fairly very easy, but remember, even after starting a basal insulin, if the glucose is higher than expected, and that might happen after a few years because diabetes is a progressive disease, and that is when you have to introduce a bolus insulin. So basal plus or eventually basal bolus regimen. Remember, when you are using a basal insulin, you are actually using insulin in the optimal dosages so as to only match with the food intake, and hence you can expect probably minimal or no weight gain at all, and with minimal or no occurrences of hypoglycemia. So the take home point is start insulin fairly early, and as responsible doctors we should be justified attending all these conventions and conferences to provide the best at the earliest for our patients with diabetes. Thank you very much.